This week, lawmakers are sharpening their focus on HCMC, and the state says it is losing its bid to get withheld Medicaid funding flowing again. Welcome to the April 17th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
This week, hospitals took center stage at the Capitol as lawmakers turned their focus to a rescue for Hennepin Healthcare and HCMC. So far, there are at least 3 proposals for financial aid to the struggling healthcare mainstay in Minneapolis. They include a 1% county sales tax and also a smaller sales tax with proceeds split with HCMC, Target Field, and North Memorial Health, as well as dedicating part of a new state uncompensated care fund to HCMC. But the Senate Health Committee got its first indication of the Walz administration's approach as Jan Malcolm testified before the committee. The former state health commissioner is now serving as Governor Tim Walz's senior advisor on hospitals and health systems. She told senators that Minnesota's health system in 2026 is like a tower in a Jenga game
that has been built over time, haphazardly adding layers on top of what turns out to have been a very shaky, if not non-existent foundation. And now people are starting to randomly pick parts out of the Jenga tower without really appreciating what are the load-bearing pieces of that structure.
Malcolm also called the business model for healthcare in Minnesota fundamentally broken. But senators also pushed back on Malcolm, saying they had concerns about governance at HCMC following the dissolution of a community board and takeover at Hennepin Healthcare by the elected county board last August, as well as the departure of 2 interim administrators after just weeks on the job. GOP Senator Mark Coran of North Branch told Malcolm something had to change.
You said, well, we've got to have another community board. No, we don't. We need a group of highly skilled people that understand the function and role of managing a complex system. And then we have to give them more tools on the continuum of care, the proper care through the right channel, all of those things. And so we're going to need somebody that's really competent, really aggressive at doing that, and we're going to have to support them. But we're going to also have to write a big check at some point in the very near future to keep them afloat.
Malcolm responded that the Hennepin County Board was weighing governance changes for the health system. In the Minnesota House, Republicans on the Tax Committee introduced a measure to offer Minnesotans $4 billion in property tax relief. DFLers like John Hewitt of Rosemont were skeptical and urged federal lawmakers to instead consider adding to previous support for EMS services.
And really the biggest cloud that's hanging over the state right now, and I think all of us can agree, is possibly the loss of our largest safety net hospital in Hennepin County. Until we have that figured out, I don't see us being able to look at the $4 billion tax, basically give back taxes.
The property tax measure joined a previous proposal for a sales tax in Hennepin County for HCMC as possible elements for a final 2026 House tax bill.
Also this week, Minnesota Attorney General Keith Ellison stepped into the Hennepin Healthcare situation, writing in the Star Tribune that HCMC could not be allowed to close. Ellison said that Hennepin Healthcare is facing a perfect storm of financial pressures, but that closing HCMC was not an option. He said he was appointing Lois Quam, a Clinton administration health official and one-time head of Blue Cross Blue Shield California, who also worked on a Fairview U of M deal, to try and shape a rescue plan for the hospital. Days later, Dr. Greg Bielman, CEO of U of M Physicians, also weighed in on HCMC. He said the hospital was critical to medical education in Minnesota. He said 1 in 5 Minnesota doctors plans to retire or leave medical practice in the next 5 years, and HCMC was a critical partner of the U of M's medical school as it looks to replace those doctors.
And speaking of the U of M, the Star Tribune reported this week the university has spent tens of millions of dollars on healthcare consultants as its partnership with Fairview Health Services wound down and Fairview weighed a separate deal with Sanford Health. The Star Tribune put the total spend on consultants since 2022 at $23 million, most of it since Rebecca Cunningham became president of the U in July 2024. A decade ago, the U was the subject of national attention by critics, including the Wall Street Journal, for high administrative costs that drive up costs to students. a charge that faculty have again raised recently under Cunningham's administration. And that's it this week from Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mockchig.
Thanks for listening.